on.
Okay, I've washed my hands, and my name is Sarah. I'm a nurse practitioner student with Nebraska Methodist College, and I am here to do an exam on your musculoskeletal system today. Is that okay?
Yes.
Wonderful. Okay, Shayla is a well-developed, well-nourished 45-year-old female. She answers questions appropriately, is a good historian, and her vital signs are normal today. So we're going to get started with the upper extremities in this video, okay?
Okay.
So first I'm doing an inspection on the anterior portion of Shayla's upper extremities. I'm looking at the shoulders for symmetry, and I'm going to go to the back, viewing the scapula bilaterally, and I do not note any gross abnormalities. At this point, I don't notice any swelling of either of the joint capsules. And in a normal clinic situation, Shayla would be in a gown where we could, that's open to the back, where we could visualize the muscles and the bony structures a little differently. But for video purposes, she is obviously fully clothed. The skin color is normal for ethnicity, and I don't notice any skin alterations, no abnormal bony prominences, and the structures look symmetrical in the shoulder. So I'm going to look at Shayla's elbows, and again, I don't notice any abnormal bony contours. I don't notice any skin alterations, and no gross abnormality in that elbow. I'll do the same on this side. No lateral or medial skin alterations on this side, no abnormal bony prominences. And now I'm going to take a look at her wrists and hands. Thank you. And again, I'm not noting any swelling, any bogginess around the joints. I don't notice any abnormal bony prominences. Palmar creases appear normal. There's no atrophy there. And again, same on the other hand, palmar creases are normal, no atrophy. I do not notice any abnormal swelling or bony prominences in her DIP or PIP joints, and no skin alterations. So again, no gross abnormalities noted in her upper extremities, and no swelling, no bony prominences that shouldn't be there that are abnormal, no skin alterations, the temperature is normal, the skin color is normal for ethnicity. So now I'm going to start with some palpation, and we're going to start at the shoulder. And what I'm looking at, I'm starting at the mid-clavicular, or not mid-clavicular, at the sternoclavicular, and I'm palpating out towards the AC joint and the sternoclavicular joint, and I'm coming down just a little bit to the coracoid there, and I'm going to reach around bilaterally, comparing each side to the lateral humerus and feeling for the bicep tendon here. I'm doing the same on the other side. And also the greater trochanter. Now, I'm going to bend Shayla's arm and just extend it back a little bit. And I'm feeling for the bursa here, the subdeltoid and subacromial bursa. And I'm also noting the supraspinous muscles, the supraspinatus muscles, the infraspinatus muscles, and the teres minor, which all cover the rotator cuff. I'm going to do the same on the other side, noting the bicep tendon again, for the subacromial bursa and the subdeltoid bursa, and the supraspinatal muscles, the infraspinatal muscles, and the teres minor, which again cover the rotator cuff. Now I'm also feeling on Shayla's back along the scapular region, noting that they are symmetrical and coming around to the AC joint. So now, in looking at her shoulders, they are symmetrical. There are no more abnormal bony prominences, and we're going to move to the elbow now. So I'm feeling for the medial and lateral epicondyles here. And there are no abnormal, any tenderness there, Shayla? Okay, and I'm also feeling for the olecranon process here on the back of the elbow, and palpating the ulnar nerve in between the medial epicondyle and the olecranon process. I'm going to do that on both sides. Again, the lateral and medial epicondyles, the olecranon process, and palpating for the ulnar nerve in between the olecranon process and the medial epicondyle. And now I'm going to start with the wrists, and I'm palpating for the radial and ulnar bones, and I'm going for the palpating the radial stylus here, and for the anatomic snuff box and the carpal bones, metacarpal bones, and MCP joints. I'm palpating those, and I will squeeze those. Any tenderness there, Sheila? Okay, and I am also going to palpate the medial and lateral aspects of the DIP joints and the PIP joints. So PIP and DIP joints. Okay, and I do not note any Bouchard nodes or Heberding nodes. Now, we're going to go for range of motion at this point. So, Shayla, let's start with the shoulders. I'm going to have you extend your... Now, I'm going to palpate Shayla's other wrist. I almost went to range of motion prematurely. But again, I am palpating the radial and ulnar bones, radial stylus, anatomic snuff box. I'm palpating the carpal bones. Any tenderness there?
No.
Okay. Metacarpal bones. And MIP joints, and I'm squeezing those. Any tenderness?
No.
Okay. Palpating those. And the proximal interphalangeal joints, I'm palpating both the medial and lateral aspects, as well as the distal interphalangeal joints. Any tenderness?
No.
Again, no Heberdine or Bouchard's nodes noted there. So now we're going to start with range of motion. We're going to start with the shoulders. So what I'd like for you to do is raise both arms up. Perfect. That's extension. And for flexion, I'm going to have you go all the way to the back. That's perfect. Extension and flexion are normal. You can put them down by your side. Now, what I want you to do is, this is for abduction, and I want you to move your arms away from your body. Okay? And back down. Abduction movements are normal. And cross one arm over your chest. That's excellent. And back down. And one arm over your chest. Internal rotation movements are normal. And let's see. What I want you to do is take an arm behind you and touch your other scapula. That's perfect. And you can put that arm down. And let's try the same with the other arm. Okay, that's perfect. Now, I want you to raise your arms out to the side and rotate them up and back down. Okay, you can go ahead and put your arms down. There is full range of motion noted in her shoulders symmetrically. I did not notice any abnormal fasciculations, no muscle tremors, and she does have full range of motion, so that's good. Now we're going to go to the elbows, and what I'd like for you to do is bend your arms and extend them. So flexion and extension are normal. Now what I'd like for you to do is just open your palms up to the ceiling. That's supination, and turn them back down. That's pronation. Supination and pronation are both normal, so that's good. Now, we're going to assess the range of motion for the wrists. So what I want you to do, turn your palms face up. Point your fingers towards the ceiling. That is perfect. Now back down and point them down towards the floor. Full range of motion noted in the wrist. That's perfect. Now what I want you to do is take your thumb, move it across your palms. Touch that fifth finger, perfect, and back. Now, what I'd like for you to do is move your thumbs out. That's abduction, and back in. That's abduction. And those movements are both normal, smooth. And what I'd like for you to do is spread your fingers and back together. So abduction and adduction movements in the fingers are normal. And if you would, I want you, that is perfect. Okay, now move them down to the heel of your hand. That's great. And open up. That's perfect. Okay, full range of motion noted in her fingers. Okay, you can relax now, Shayla. So overall, normal range of motion noted in all upper extremities. Muscle movements were smooth and controlled. I did not notice any abnormal muscular fasciculations, and that's fantastic. Now, should Shayla have reported problems with shoulder pain, I would do the Mears test or the Hawkins sign to determine whether or not she had some nerve impingement in the rotator cuff area muscles. I could also do the empty can test where I try to get her to turn those cans back up while I'm holding her wrist and she's resisting. Also the drop arm test to see that she had controlled movements and there was no pain as she's raising and lowering those arms. So I think this concludes our upper extremity test. Do you have any questions? No, thank you.
Thank you.